Hello and welcome to another episode of Wellness. Today we focus on endometriosis, one of the most misdiagnosed conditions in women. Many people are often not comfortable talking about personal matters. One such subject is a woman's menstrual cycle. But something unusual or painful during this delicate time can be a warning sign. I will be joined by Dr. Frank Odawa of the Kenyatta National Hospital.
It's an elusive condition, the more reason why people don't understand it. I would assure you, even among ourselves as medical practitioners, it is a disease that we don't have a 100% understanding of its nature.
The obstetrician and gynecologist will tell us why tissue mimicking the lining of the uterus forms in other parts of the body.
Endometriosis simply means endometrial tissue that is not where it's supposed to be. The endometrium is the inner lining of the uterus, all right? This depicts the female reproductive system. So that is the endometrium. It is also the site where the baby grows. Once the egg is fertilized here, it's brought back to grow there. At that time, it is prepared to sustain the baby or the pregnancy. Right? So this is the only place where the endometrium should exist. In a situation where the cells that are supposed to be here, the so-called endometrial tissue, grow outside that site, and that can be even on the ovary, it can be on the fallopian tube, it can be even in the cervix, it can be in the vaginal canal, it can be anywhere else, including the lungs. You must have heard of the famous lady who had lung endometriosis and actually had to have lung surgery, lobectomy. A number of ladies sometimes menstruate from their navels during menstruation, the umbilical stump. All that is referred to as endometriosis.
Okay, so what really triggers the symptoms?
A few theories have been adduced as to what causes endometriosis. One of those is that the endometrial tissue follows the bloodstream or the lymphatic channels and then goes and implants itself outside the uterine cavity. That is one theory. Two, it is possible that during surgery, like cesarean section or any surgery involving the uterus where you will open up the uterine cavity, in the process of that surgery, some of the endometrial tissue finds its way out or it seeds out, then it implants somewhere else. All right? That's called translocation. The other theory is that some other tissue, which is not supposed to be endometrial tissue, just undergoes transformation and becomes endometrial tissue. That has also been thought. It is also thought to be genetic because in certain families, you find ladies having endometriosis more than others. So there could be a genetic element.
What are some of the most presenting complaints?
Now, the symptoms include, and most often, pain. And the most common pain occurs during menstruation. We call that dysmenorrhea, painful menstruation. It is thought that at that time, when the endometrium is shedding to flow out, these cells, wherever they are also shedding because they respond to the hormones of the woman's body the same way as the endometrial tissue in the uterine cavity. Now, the difference is that wherever they are shedding, they are bleeding, but the blood is not coming out. Unlike when it is normal menstrual flow, where the blood comes from the endometrium, passes through the cervix and through the vagina and goes out. So this blood is shedding here, wherever it is. It has no outlet. So it irritates the structures around it. The structures around here are very sensitive. is called the peritoneum. The peritoneum is the lining of the abdominal pelvic cavity, and even the uterus is lined by some peritoneal cover. They are very sensitive. They are innervated. They have nerve supply. So if it is being irritated, and that time the uterus is also contracting to expel the blood, that causes pain.
At what point does this pain become more than normal?
When a patient has endometriosis, we have different presentation. The commonest presentation is pelvic pain or pain. And this pain is very specific. It's really worse at climaxes during the period of menses. So a patient, for instance, will come and present during my menses, I have this very, very excruciating pain, and has worsened over years. But off menses, it could get better. Some might not really completely resolve. It can be a complaint of pain while passing stool or pain while having sexual intercourse. So when we have these specific symptoms of pelvic pain that is very specific to menstrual cycle, then it can suggest it's actually endometriosis.
Like in Wamboi's case, symptoms are non-specific.
I actually don't know how long it was going on, but what triggered me was the periods coming back severely after 5 days. So that's what led me to hospital. And then I was told they're not as bad and I can survive and I can continue with my life and I don't need medication or anything. So yeah, I went on for years until one day in 2017, my serious pains started every time I had periods. So I kept going for scans, but they never showed that I had endometriosis. So fast forward to 2020, when I decided to go for surgery for the fibroids. That's when I got an MRI that showed I had endometriosis at the 4th stage.
The other is painful sexual intercourse. By virtue of the same phenomenon that I've described, blood being out there, irritating the structures around, during sexual intercourse there is motion of all these organs, and that causes pain during intercourse. It's called dyspareunia, all right? Those are the commonest manifestations of the same. However, if this takes long and it is not addressed, a girl or a woman may present with infertility. In other words, they are not able to get pregnant. The reason? Because when those endometrial tissue, which is out here, keeps bleeding, but it has no outlet, it may cause inflammation here or irritation of the structures. That may lead to blockade of the tubes. The tubes may get blocked. In fact, the commonest cause of infertility in our women is if the tubes are blocked. But it's not only endometriosis that causes blockade. Most of the other time, the blockade occurs because of infection that has come in through the vaginal canal, found its way into the uterus, through the tubes, and inflamed those areas. That can be sexually transmitted infection. It can also just be contamination from around the vaginal opening. So infertility is another presentation. Now, these people may also manifest with low esteem, low energy for the fact of this chronic pain that they are experiencing, all right? So those, you will call it, they are irritable.
The pains were really, really severe. Yeah, I couldn't go to work. When I was on my periods, the second day was the worst. So I couldn't go to work. So I would stay home, stay in bed all day. I couldn't do anything, even simple house chores. I couldn't do them. So yeah, second day, then the pain would subside within the third day, like that until my periods were over.
A few times it's thought that endometriosis is more common on plump, fat girls, obese ladies, etc. That may be an observation. May not necessarily be true, but that's possible. To that extent, it's been thought that weight gain could be useful. it's been thought that weight gain could be useful. But insofar as causation of endometriosis is concerned, I don't think there's any lifestyle phenomenon or change that may prevent it. No. For the fact that it's that elusive, understanding how it occurs in itself very difficult, there's no lifestyle change that is known to prevent endometriosis. Unless you're asking, what is it one can do to alleviate the suffering or the symptoms and the signs? Of course, yes. If it is pain, give painkillers. If it is the fact of the presence of the endometrial tissue, we are now going into treatment, in other words, and alleviation of the symptoms and signs. There are certain hormonal medicines that have been shown to be useful in treating or preventing the suffering associated with endometriosis. The hormonal contraceptives have been shown to have a place. Hormonal contraceptives, be it estrogen-based, be it progestogens. And in whichever way you administer them, they can be injectable form, they can be oral form that you swallow, they can be put in the uterus, intrauterine devices that have the hormones or the progestogens. They can be implants put on the arms. Those are also progestogens for the most part. And there is this group of drugs called the gonadotrophin inhibiting agonist. This is a special kind of hormonal preparation that is most useful for the treatment of endometriosis. It is given in injectable form for the most part, but there are also oral types that are given. That will prevent the escalation of the endometriosis as well as reduce the pain associated with it. There are also surgical modalities of doing it.
Let's start by understanding the available forms of surgery when it comes to endometriosis.
There are two different options for surgery. You can have open surgery, which is a traditional surgery that has been there for a very long time. Just make an incision on the patient open for you to gain access to the structure or organs of interest. But of recent, we have what we call minimal invasive surgery. So we use tiny incision to be able to access the same structures. So with a camera and small instruments, the same job can actually be done. And laparoscopy has numerous advantages as compared to open surgery. So we are trying to shift from open surgery to laparoscopy.
Can you come? The plight of a Wamboi, an endo warrior, is familiar.
I had a laparoscopic surgery, which is it's actually called keyhole surgery. They make small cuts on your stomach that are the size of a keyhole, and then with those small cuts they get rid of whatever issue you have. And then so I opted for that as opposed to the open surgery because of a few factors.
Which are?
First of all, it's kind of less pain. It's not really less pain, but when you compare to the open surgery, the healing process and the time taken.
What is there to expect during the operation?
Your objective for surgery is to cut off and remove this nodule or lesion or the growth, whatever you want to call it. So when we go in, for instance, is you will identify where this lesion or this nodule or this growth is, and then you need to excise it. And then you hear now there's a talk going between ablation and excision surgery, and patients are really smart now. They are asking, do you perform ablation or do you perform excision? Now, excision is quite advanced because you need to open structure, you need to identify structures and make sure that structures that are beneath the tissue that you can see are actually safe. When you talk about ablation, you're just burning or cauterizing. That's not the appropriate medical word, but you're just burning the tissue. But you're burning superficially, and you really don't know how deep this nodule is growing. Endometriosis, we know, is what we see as an iceberg. Much of the disease will be beneath the surface, what you're seeing. So our intention or our objective is to go and cut out this the disease or the nodule. And it really depends on how advanced the disease is. So sometimes it's very superficial, it's just lining, it's just implanted on the lining of the abdomen. Sometimes it's very deep, sometimes it's invading structures, not really necessarily removing structures, but removing the disease.
Let's talk about post-surgery. What is there to expect? How painful is it?
The surgery itself is not painful because once you come to the operating theater, we're going to put you to sleep. So you're not really going to, to feel the pain.
How long does it take for the pain to go away after the operation?
It's usually after the surgery. And this is now we take the care after surgery. This is very, very important. And with good care, pain management after surgery, the pain should be bearable. So we have different options of pain management after surgery that we can use to be sure that the patient is as comfortable as possible.
It took a toll on me, but I got all right, considering I had gotten rid of the situation.
Mm-hmm.
Yes.
Meaning now your doctor cleared you and...
Yes, now I'm fine. I have no more pain. I haven't had pain in a long time, since 2021. And my stomach has decreased. Yeah. Endometriosis gives you a really big stomach, so people will think you're pregnant and you're not pregnant. Yeah. So it was a good thing.
Yeah.
To have
Okay. Now, after you learned about your condition at the time, the endometriosis and the fibroids, were you worried about, perhaps not being able to get children?
Yes, I was actually really worried, but I used to hide it. I used to act strong, especially in front of my family. And actually my mom was worried, so she used to keep asking me, like, what's the progress? And since she didn't really know or understand the whole thing, so she used to ask me, can this thing make you not have kids in future? And I was like, yes and no, it depends. So I really had to go to hospital. Yeah. And
so how about now that you're out of the woods?
now I'm good. I'm looking forward to having children. The future looks bright. Yeah.
Wow.
I'm happy about it.
That's amazing.
Yeah.
Thank you for watching Wellness with Wanjiru. My name is Wanjiru Thuku. Until next time, goodbye.